way classes work at Regis is totally different than any other program I've been in. So classes are not split up by the medications, the disease states, the treatments, the clinical guidelines. It's all in one class. So we have one class called Integrated Pharmacotherapy. So in that course, we kind of learn one disease state at a time. So right now we're about to start hypertension. So we'll learn about what causes it, what the symptoms are, and then we'll also learn the treatments, the mechanism of action, and things like that, all in that one class, so that you don't have to remember later what the symptoms are.
So Regis uses an integrated curriculum, and not a lot of schools do that. Regis does the integrated, it's called integrated pharmacotherapy, where you learn kind of the pathophysiology, the biochemistry, the clinical aspects, the diagnostic aspects, you know, where this whole disease state is in clinical practice. So you learn about everything that has to do with hypertension, all in one.
On top of that, we have supplemental courses. So in the lab, we're learning how to make capsules and tablets and liquids and gels and suppositories and just kind of all the things that you might compound in a pharmacy. And then we have our IPI course, which is our clinical course. So in that course, we're learning how to be a professional, how to interact with professionals, how to take a clinical guideline that we're learning in class and apply it to a patient professionally, and how to use the terminology that's commonly used in a clinical practice. And we also learn about the top 200 generic drugs that we might see. So it's the dosing, the names, you know, between brand and generic and things like that. So that's more, how do you apply what you're learning in class to a clinical setting?
You're not just going to class, just sit and stare at a screen. So it's a lot of active learning versus passive learning, and I don't think I could go back to lecture-based teaching.
You're going to be asked a question by, say, a physician, and it's going to require you to encompass everything, not just one little thing at a time. You're going to need to consider the mechanism of action of the drugs. You're going to need to consider, you know, what therapies are best for this patient, considering their comorbidities. You need to consider insurance, you know, what can this patient afford? You know, like these types of things are, I guess, ingrained in us because we're learning about them all at once.
So one of the required rotations is a hospital setting. So you would start bright and early in the morning, doing rounds with doctors, nurses, social workers, physical therapy. You work up patients, you get to go into patient rooms and counsel them. It's very interactive.
So myself in particular, my past 2 experiential sites have been with other students from other schools, and I've definitely seen a difference in my confidence to use clinical guidelines while I'm there. When the pharmacist asks me about a drug of choice, and a lot of other students might look at their pharmacotherapy notes, I'm so used to applying those things because of the way our classes run. You take a patient case and you apply the clinical guidelines every single day.
So some feedback that I received from my preceptors, so the pharmacists that I report to at these different rotations, is interaction as well, well-spoken. Interaction with other healthcare members is very professional. In addition to the solid knowledge foundation, I can voice and articulate my opinions and thoughts on what I think is best for the patient and advocate for them.
I think Regis, by far, surpasses the other schools, and you don't really just have to take my word for it. Being a Regis student, every single rotation that I've been on, multiple pharmacists, physicians, nurses have stated that there is a difference between a Regis pharmacy student and a pharmacy student.
So a combination of the team-based learning as well as the integrated curriculum, I would say, prepared me above and beyond what I had expected to be knowing by my P2 year.
Regis helps you prepare in the team-based learning to show those professional skills. They come out in APPIs and IPPIs, and a lot of my classmates, including me, have gotten job offers because of that. So Regis's mission, care for the whole person, is integrated in the whole curriculum in all 4 years. You learn about Jesuit values and the history behind it in the first year. You have service learning that's part of what you do all 3 years. And then in the 4th year it comes out as reflection, and you truly see yourself serving others.
They don't only just put them on their website, you know, and just say them like, these are our values, this is our mission. They incorporate it into our curriculum. So one of those is Cura Personalis, which is care for the whole person. And, you know, a lot of people are like, well, what does that mean? Like, when you treat a patient, you're obviously treating the patient, right? But when you actually get out into the medical field, you're in your clinical practice, you will find that a lot of healthcare providers do treat the patient just like a disease state.
For example, I worked in a mental health center this summer, and those patients especially need some advice on how they can do things without treating it with medications. So I got the opportunity every day to really help someone with Cura Personalis. I was really treating the whole person when I was dispensing a medication maybe for depression, and I was able to ask that person, how have you been sleeping? How have you been, like, what do you do in your free time? And Regis is definitely, a Regis pharmacist would do that. A Regis pharmacist would reach out to that patient knowing they have depression, knowing they're treating their depression.
As far as residency, school is very big on residency, and all faculty are more than willing to help you along the steps of a residency and to help prepare you for that. There's even a residency boot camp that you can sign up for.
The faculty are willing to work with you, willing to do everything they can for you, especially if it's service-oriented. And then also we have affiliations through a lot of NGOs, like Eli Abroad is one example, and myself and another 3rd-year student are going to Cambodia for one of our 4th-year rotations.